Okay, I'll call the meeting to order. And I'll just ask Jared to make sure we have a quorum, which I see we probably do.
Madam Chair, this might be one of our better attended meetings, both in person and online. Not sure if it's a full house, but it's pretty close.
That's fantastic. Okay, so maybe what we could do is start with those folks online. If they could introduce themselves, that would be great. It's hard for me to read the names here.
And Madam Chair, I can go in and help with that.
Okay.
So it looks like we have 3 voting members online. We'll start with Dr. Babbitt.
Hi, everyone. Sorry I can't be with you today, but I know we'll have a great meeting. I'm glad to hear there's great attendance.
Thank you. Jen Nemo.
Good morning, Jen Nemo, Colorado Community Health Alliance, serving Medicaid in, a lot of regions now, or a lot of counties, all 7. I'm trying to remember them. Park, Teller, El Paso, Gilpin, Clear Creek, Jefferson, and Boulder County.
Thank you. And Rosemary Jaramillo.
Hi, Rosemary Jaramillo with the Alzheimer's Association. Our office serves 18 counties.
Madam Chair, that's the voting rec members we have online.
Thank you. So if we could go through the members that are here at the meeting, and maybe we can start at this end and there. It's yourself?
I'm Clark Becker. I don't know that I haven't heard that the Teller County Commissioners have officially appointed, but I think they're close. Anyway, I'm representing Teller County and part of the Teller County Senior Coalition Board.
Yes, they have, but I think that Jen is going to mention that when she talks about her membership committee. Thank you. Thank you.
It's Don Kowaleski. I'm from Falcon, Colorado, trying to represent the Eastern Plains community out there.
Or Chronic Town of Monument.
I am Debbie Levin-Stankiewicz from Colorado Springs, the chair of the RAC.
Gordon Rick, the city of Fountain.
Melissa Martz with the Pikes Peak Area Agency on Aging. Sheila Williams, Park County representative.
Susie Walton, Park County Human Services Director, also.
Hey, this is like our largest committee. It's wonderful. We have from all 3 of our counties, which is fabulous. Okay, so the next thing we need to do is agenda approval. And I'm wondering if I can get a motion to accept the agenda.
So move.
And a second.
Second.
Thank you. And then we just need to vote. Those online can raise their hand and those here can say aye.
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 And consent items, which is number 3 on our agenda, and that's a motion to approve the minutes from the previous RAC meeting. Do I have a first?
So move.
Second?
Second.
Have a vote to accept the minutes, approve the minutes?
Aye.
Great.
Aye.
Thank you. And I will ask, we're on number 4 here, and I will ask Jared if we have any public comments.
Madam Chair, I'll ask anyone who's online to please use raise hand function. Let us know they'd like to provide public comment. And I'd ask anyone in the room who'd like to provide public comment to please make their way to the podium at this time. While we're waiting for those 2 things to happen, I'll just let the committee know that we did not receive any advance requests for public comment, and we did not receive any written public comment that we would have distributed to the council members in advance of this meeting. Having said that, I see no hands raised online. I see no one at the podium, so I think we can proceed to the next item at your discretion.
Great, thank you. And now we're on number 5, which is action items, and I do not think we have any action. So now we're on number 6, which is our presentations. And the first presentation is going to be Penny Everest. She's the executive director of the Park County Senior Coalition. Welcome, Penny.
Thank you.
Well, we're welcome here. We're glad you're welcoming us here.
Yes, yes. Good morning. I'm Penny Everest. I'm the Executive Director of Park County Senior Coalition. So Commissioner on Aging. I want to give you a brief overview of the Senior Coalition. Let's see here. Our mission is to keep seniors in their home as best able. Overview of the Park County senior population. Number of residents is 18,117. About 22% of that is seniors. And we're looking at like a 1%, maybe even a 3% growth in our county. One other thing that we did this year, we opened up a Bailey office, which is a great thing. Seniors up in Bailey. Our current services available are chore, homemaker, travel, vouchers. Chore is for cleaning and yard mitigation. Homemaker is for cleaning a house. Those two particular services do require some additional ADS ID. We have a travel voucher program and a food program. Additional services need, oh, I just want to back up here. Sorry, guys, I'm a little new at all of this. Let's see here. Total served, if you can go one more. Total served is 1,183, 191 chore. This is for the year. 1,900 for medical and groceries. Homemaker, 1,130 hours, and then 5,614 served. Additional services needed on the senior clinics. Public transit available for seniors, shuttle services, or volunteer driver. Gaps in geological coverage. Social and recreational programs that we're looking to. Senior centers and community centers. Organized activities, fitness centers, crafts, and games. Seasonal events. Your Alliance over here has been unbelievably helpful that we put together. Key challenges are transportation across the rural areas, limited funding or staff programs, digital divide, mental health support. Seniors are unavailable. Community partnership, highlight existing provisions, suggest strengthening interagency coordination, solutions for support requests, funding for a new senior outreach, expansion of transportation program. I want to thank all of you for allowing me time to stand up here, and they'll be better at this next year because I'm not really. Thank you all. Yeah, thank you. Thank you. And I just want to open up any questions.
Can you just tell us a little bit more maybe about your pantry and meal program?
Yes. We offer to each single person, we offer 2 boxes a month, and we have a shelf-stable box that has frozen box, which has 5 meals. Very popular. We go all the way down through the north part of Park County and the south part of Park County. And our seniors are unbelievably really happy about the fact that we're able to deliver this food to them.
Do you have staff or do you have volunteers delivering?
Volunteers.
Volunteers, fantastic.
And the freezer program, tell us about that.
That's for the frozen food. We have a large freezer downstairs that can hold up about 200. And then we have freezers throughout the counties. We have one in Bailey. We have one in Kentucky. So these freezers are unbelievably great, so that when you have a person who doesn't have any food in their homes, send somebody over to those community centers.
Ask a question given the geographic challenges of the size of Park County. Can you talk a bit about it's got to be a challenge to
Yes,
say
it
the least.
is. Yes. It is the voucher program, and we have an assisted voucher program and a regular voucher program. And you get 2 days, 4 days worth of 2 days for a single, 4 days worth for husband and wife. And We have the drivers that come, we do the north route at the beginning of the month and the route down to the south at 2 weeks into the month.
And is part of your county serviced by Teller County? Some of the services that
They
happen
kind of
in
cross
Teller?
over each other, but Teller actually can help out with a lot of things.
Questions?
Penny, I've been really impressed with the extra outreach that you have done and the bridge building that you've done across the county, because the agency was in not the very best shape, not all that long ago. And the bridges you've built with the outreach. So for instance, you're going this weekend, right, with my veteran service officer to Borough Days, and she'll have a booth and meet with seniors and get people signed up. And I just think that's amazing. And then also all the work that you've done with Seniors Alliance of Platte Canyon. I think
They're going to be our next.
Perfect.
So hi, Penny. Thanks for sharing all of this. You talked a little bit about senior centers. So share a little bit more about kind of why you are hoping to get a senior center in Park County, because sometimes I feel like, you guys have kind of some things happening at the Alliance for Platte Canyon, Senior Alliance. And is there still a senior meal program here in Fairplay? And so then just kind of talk a little bit more. And then you guys have done stuff in Lake George where you've kind of had like a senior center in Lake George. So maybe talk a little bit more about kind of what your thinking is about wanting an actual senior center and kind of what that might be looking like in the next 5 years.
Really good model is what the Alliance is doing up in so many things for the seniors, just to bring them. Just being able to communicate with them a couple of times. We do a brunch once a month. Seniors, absolutely. We tried opening it up throughout the other. We had about 13 participants there. And so we're thinking about doing some work. We would love to have more community centers, definitely be able to bring in seniors from the other areas, similar to what Taylor is a huge want for me to be just like them even.
Thank you so much. We appreciate it. And we'll move on. We have another presentation today, and that's Patty Lucy. Is that how you, Lucy? And Lucy is a board, Patty Lucy. And she is a board chair at the Senior Alliance of Platte Canyon, which was mentioned earlier.
So thank you. And as Penny said, I'm with Seniors Alliance of Platte Canyon, better known as SAPC in our community. And the reason that SAPC even exists is because about 2019, we had some community members who came together to meet a void that existed in the Platte Canyon area, because at that time, the Senior Coalition struggled to cross Kenosha Pass. And so the seniors in the Platte Canyon area were not receiving services and didn't really have any support system. Because we're so close to Denver, Dr. Cog would be our more easier access, but they don't cross Jefferson County line, which is only like 5 miles from us. So it's an issue. But anyway, what we did is we came together, formed a board. We're a nonprofit, We are all volunteer. We don't have any paid staff. And we have a small office also in the Bailey Center. We staff it 4 days a week, 4 hours a day, all with volunteers. And one of the things that we have, so we operate on 4 pillars: advocacy, socialization, education, and resources. One of our biggest successes is our nurse lending closet. And in our nurse lending closet, we have all kinds of durable medical equipment: wheelchairs, shower chairs, walkers, knee scooters, crutches, raised toilet seats, anything you can think of almost we have. And we loan those out to anybody in the community at no charge for as long as they need them. If they're recovering from surgery, if they've had an accident, we've even lent them to the local high school students who often are injured in their sports activities. We've lent them out. I think we have a wheelchair in Pueblo right now, actually, that we may never get back, but the things do move around, and it's a really popular program. So along with that, we also, in terms of healthcare, we have been supporting the Dude Talk Dinners, which is a Park County Mental Health Alliance program. It's modeled after a program, I believe, in Gunnison. And the purpose of it is to bring men together once a month, just to have an opportunity to chat about things that might be on their mind that they may not chat about at home, and to form some camaraderie. So we've been supporting that. I was passing around our playbook, and that's something we developed. We participated the last few years at MindFest, which is a mental health program that the Conifer Rotary has been having. And it promotes primarily mental health in the community. So we designed and put together an activity book for our seniors, which has been very popular, and we're about ready to need more. That's why there's only one class. Also, in terms of healthcare, we were big supporters of the Health Services District Initiative. Unfortunately, it will not be on the agenda this year, but that group will continue to try, and we will continue to support them because there's a huge need for health services in the Platte Canyon area. We do not have a doctor, a pharmacy, a grocery store, anything. So that makes it very difficult for our seniors. Along those lines, we try to provide transportation, not that we provide it ourselves, but we have a lot of seniors that go to Denver for their medical appointments or need to pick up something at the pharmacy in Conifer. So we, via social media, always put out requests saying, hey, if you're headed to Denver on such and such a day, we have somebody who needs to go to the VA hospital. So we're pretty successful at helping people get rides to their medical appointments. And then when we have partnered with Core Electric, and they provided us some funding, and we purchased electric blankets because we have seniors that struggle to keep their homes warm. And so the electric blankets were a really good program because they can move it from the sofa in the living room to their bed or wherever they want to be. Just take it with them, and it's a way for them to stay a little bit warmer if they're keeping their house at a lower temperature. For those who have emergency needs, such as their boiler goes out or their furnace goes out, we also have a couple space heaters that we were able to purchase that we lend out to them, which has been very popular also. In terms of education, we partner with a number of organizations locally. We have Fire Adapted Bailey. They have done a number of programs teaching people how to prepare for emergencies, especially wildland fires. We know from the California fires that like 85% of the people that die in those types of emergencies are over 65. So they do training on how to prepare and what to do. And one of the things I passed around was a Got5 card. And that is something that we encourage all of our seniors to put on their refrigerator. And so in case of emergency, you've got it right there in front of you. Who do I need to call? And you've got 5 choices in case the first couple aren't around. We also have a lot of families that are now using those for their kids too. And there's an electronic version that the Fire Adapted Bailey put online because they thought also was a very happy thing. We've also, August 6th, we're doing a class on online shopping because we have a lot of seniors that will call Safeway or King Soopers and Conifer and do their shopping online. And so they struggle with using digital coupons and how do I do this securely and how do I get somebody to bring me my groceries? So we work with them and we're having a training on that. And we recently had one on password protection for seniors. Just little things to make their lives a little easier. Let's see, what else have we done? We do care for caregivers. We've partnered with Conifer Counseling, and they did a presentation for a lot of our caregivers because so many people are caring for a spouse and really need that support. We've also partnered with Natural Grocers, and they did a Nutrition 101 for us and brought samples of healthy food and recipes. And now, I think it's in October, they're going to do a presentation for our community on cooking when you have pre-diabetes or diabetes and how to prepare healthy meals. So that's, what else? That's so much, it's hard to remember actually. It is, huh? Especially because we're operating on such a limited budget and with all volunteers. This Saturday is our annual ice cream social. We've done it 4 years in a row. It's free to all seniors. We encourage them to bring their neighbors and their family, and we have ice cream and music, and sometimes there's dancing. It just depends what motivates people at the moment. That'll be this Saturday. Our annual fundraiser, which is the primary way we make money, is our Gold Rush Fever event, and that's held at Glen Isle in September. We have a barbecue dinner and a DJ who we do dancing afterwards, and do s'mores out over the campfire, and then silent auction. That's been a big hit. Sold out every year, so hoping it will again this year. And then this year in May, we had our first ever afternoon tea, and everybody who came, we had a local tea expert do presentation on history of tea and little tidbits of information and humor, how it came across, not exactly from the Tea Party, but a little bit of that history. And everybody who came went home with a vintage saucer and teacup and a fascinator for their head. And we did real loose leaf tea. So we did black tea, white tea, and green tea. So they'd get a good exposure to the different kinds of teas. And we've done a couple swing dances, which were really popular. And this year we're trying to get a line dancing class in late August, because at our fundraiser, a lot of people said, we want a line dance. We're like, well, but maybe we can get you a class and we'll teach us. So we're going to try and do that. So we just really try to, as Penny had mentioned, isolation is a huge problem for our seniors. And so we try to do activities that will bring them out in the community that don't cost them very much. Most, like our ice cream social was for free. The tea, I think, at $15 a ticket, but cost money on it. So we had to buy all the stuff. So, you know, they're fairly basic, simple things, but they do get the seniors out. We had a request to start a knitting class, so we're now doing knitting classes every other Friday, and that's been fairly successful. Couple other things we do for health really quick. We have Mount Evans Home Healthcare out of Evergreen come over to our office every other month and do a blood pressure clinic and foot clinic, especially for people diabetes or who have trouble doing their foot health care. And then we also work with MRC, the Mountain Resource Center out of Conifer, and they bring their mobile van to our parking lot every Wednesday for about an hour. And they always have fresh food, stable, shelf stable, and sometimes frozen meat like that. that anybody can come. There's no pre-qualifications. So it really helps out the boxes and the frozen meals that Penny is able to provide for them. So that's kind of what we do in a nutshell. And then the one thing I did pass out, I really would like you all to look at because we're so proud of it, is we just put together and published our resource directory. It's something that we've had a lot of requests for, and it's very professional, very well laid out, easy to find sources and services. We have an electronic copy and we have the hard copies for those people who don't access. That is one of our big successes this year.
How did you fund? I mean, this is a big undertaking. How did you fund this?
We funded that each year. There is PCCP Resale Boutique in Bailey, and they are a nonprofit boutique, secondhand. And every month they choose one nonprofit in the community, and that nonprofit receives all of their profits because they're run all by volunteers. So last year we got approximately $4,000. And we used all of that money to fund this because we knew that would serve the community, everybody.
It's beautifully done.
Isn't it nicely
It's
done?
really beautifully done. It's very nice to have. And yeah. So do you have a lot of these available at the Senior Coalition office or is it more locally?
Penny had some, and then we have some. We printed 500. That's what we could afford.
Mm-hmm.
We are updating the electronic copy every quarter, and then this will publish once a year. But what we are doing, and we put it in the back, and we're really encouraging local businesses, is we will sell a quarter-page ad for $100 a year, which we think is a really good price. And so we're hoping that organizations in our community, now that they see how professionally it was done, will buy ads and help offset the cost that we will have to put new ones next year.
So I was here, and I just remember that, and I don't know if that was the start or just the continuing of really a working together with the Senior Coalition, but it's just amazing all the things that have gone on since that meeting. But I'm a little confused. Does your organization cover the whole county, or do you just, and I'm not familiar with Park County that much, and I don't understand exactly what Platte Canyon is, and maybe you could explain that.
Gladly. The Platte Canyon area is basically the Platte Canyon School District area. So it's from the top of Kenosha Pass to Pine Junction, and everything in Park County in between those two places. We really service that area primarily because the Senior Alliance was developed to fill that void when the coalition was not able to provide services over there.
And is that by Bailey? Is that?
Yes, it's Bailey, Grant, Sean, part of Pine and Pine Junction. Those are the primary.
Because I remember someone saying that there are some people that go into the Denver area for some of their.
Everybody in Bailey primarily accesses services of any kind in Conifer, Denver area.
So it sounds like it's been a great alliance for the two of you to work together, and that you're serving the whole county a lot more than previously. So that's great to hear.
It really is, and because Penny has the funding to do the meals and do some of the chores and things like that, she's able to focus more on that, and then we try and support her with volunteers when there are a lot of times work with human services organizations to help seniors who had some really large needs, and then we try to do more of the socialization things. And there may come a point when we are able to reach further out into Park County, but at this point, because we're volunteers and we don't have any government funding, we just don't sources to do that.
It sounds like you're doing a lot. When you listed all those different social services and activities, I think it's pretty amazing that you
We
have
have a
all.
really strong, active board who all really believe in what our mission is.
Say this book is,
We have an electronic version online. If you go to our website, you can just pull it up. And that's the one that will be updated quarterly because it's much easier to update an electronic version than to print a hard copy. If you look at our brochures, I think all of you have a brochure and it should have the website on it. And then there's the QR code on the front of that that takes you directly.
These back.
Oh, that would be great. And I know Penny's got the link on her website. And I think Susie, I think Human Services put it on your website and Public Health did. And Emmy Glancy West said she'll eventually get it on the Park County website. Yep. Anybody will have access to it. Actually.
This is taking. Maybe we'll just take one back with us or something.
Sure. I mean, you could take all 4 of those if you had use for them.
Well, we don't, I mean, you said you had such a limited printing, so I think.
We printed 500 and we're down to just a couple months.
Yeah, so we don't want to take that away from you. Well, thank you so much.
Well, thank
Does
you.
anybody else have any questions?
I have a question. Very impressed with what you have going on. But what I want to know is, what is the age group of the volunteers that support you?
About my age, seniors, retired people, because they have the time.
So
No youth. I mean, like we've worked with our Key Club at the high school. We have referred people to the Boy Scouts. So we have this really fine line. We had some people who needed assistance with yard work. And because we are primarily older seniors, a lot of our board and our volunteers don't really do a lot of physical activity. And so we were going to recommend the Boy Scouts. Well, our insurance company told us that normally that would be okay, but because we're such a litigious society, that what we should do is refer them to our directory and say, we've heard that there are community groups, youth groups, churches that provide services. So please feel free to reach out to those and keep ourselves.
Maybe Penny could comment on that as well. Do you get a lot of requests for that outside yard work and those kinds of things as well? And what do you do then?
I did see in the directory that there are some people listed who do handyman services in here, so I thought that was good. And I don't know how often are those individuals contracted sometimes and get reimbursed through Park County Senior Coalition, or does that happen at times too? So.
Doesn't the yellow book cover?
This. Yeah.
Makes a little noise like a page flipping. It's kind of fun.
I love the playbook. Love it.
Yeah, it's really nice.
Like 2 feet apart. That's really made it a lot easier for us to work together as having.
lead in the funds, there's an admin. Like, if it's possible, I would staff to see if we can get so they can.
Answer that. Are you doing the director's report? So maybe you can talk a little bit further about that. Yeah, and I know I think it's next year. I think in June we'll be starting that new year. We will be sending out our RFPs for. Okay, we'll let you take on that. Any other questions?
Hi.
About 2/3, actually.
Mhm.
Like 2 different counties almost.
Well, I know Penny mentioned, I think it was about 1,100 people were served. So that's about, it's not 10% of your population of the whole county. So I don't know if you have any numbers on how many people you're serving in terms of.
So because we don't do food assistance or anything like that, we do keep a log of all the incoming calls. And I believe in 2024, we had about 380 calls last year, and those did not include our nurse funding costs, which I believe total we provided equipment to 80 people last year, and most of them because of surgeries and the.
Do you keep the names of the people that attend your activities and things
Yes,
like
we
that?
always put a sign up sheet and ask.
So I'm sure you have a lot more people that you're serving than just.
Send our email. We send an email out twice a month. To apply.
So when you add those two together, it is almost 10% of the population of the county. And that's a lot. Great.
It's more like a comment. Since I've lived in Park County since 1977, and I probably predate some of you that have lived in Park County, I have seen quite a growth in the area, and I really commend I would like to see this expanded throughout our county because, as you know, it is a geographically diverse area. With a lot of national forest, state owned property. So we have a communication problem because we don't have a central communication area. The newspaper gets to Lake George days after things have happened. So we need to work on communication and transportation. There is a desire for the Park County Senior Coalition to get some sort of transportation started again. They used to have vans.
And it's still.
They used to come all the way to Baylor to do recreational trips. So that is something that I would like for us to look at as far as funding or assisting in achieving the funding. Two organizations have come together and we are meeting together in September. I don't remember what date it is. We are meeting together as a group in September. So thank you so much for to our small area. We do have seniors that are defiantly independent, I will say.
And that in of itself can be quite a struggle.
And that was going to be my next question. How often do those joint kind of meetings happen a year? Would you say? You said you had one coming in September.
Doing it like this year, but because we're cross-boarding, we're able to share that communication every month.
And the last question I have, what's been happening with broadband and internet in your area?
Highline, I'm in Berlin and I have Highline now and I love it because I had CenturyLink and I had.
So much of what you're talking about, you're doing online as well. Is that an issue, a major issue? Spotty, hey? Mhm. I think the state's budget problems have put some kibosh on, I mean, I think Jen, our membership chairperson, was talking about that at our executive committee meeting, but I know it's an issue for the entire state, especially the rural areas. Well, great. Thank you so much for your presentation.
Me to present.
You learn a lot at these rural attend. All right, so we'll move on then, and maybe we'll go to 6B, which is our membership committee, which is Jen. And she's gonna give us a little bit of a summary of anything that's going on.
Hello. So I don't have much update here. I did see an appointment letter, but I don't know that I've gotten anything further for Clark's appointment from Teller County. And Melissa, feel free to jump in if you've got anything new to add to that. I've
Jump in right
I
now.
did-
Yes, it has been, it's formally done. So this note on this agenda is just to make it formally known that they did send the letter, and it actually came right after our last RAC meeting, but before the PPACG board meeting. So it actually got snuck into the PPACG board meeting. So the PPACG board is
Right.
aware of it. And so now this is our formal. And actually, they don't even get to approve it.
Oh.
When the jurisdiction appoints, they just have to agree. They could comment on it and make comments, but it would be really hard for them to not accept an appointment from jurisdiction. So that's why we don't, as a RAC, also vote on it either. But so it's official, and so Clark is officially.
Well, Clark has been sitting in, but I will officially welcome him, and it's great to have you as a member of our RAC.
Thank you. As a recovering Teller County Commissioner, there was some concern there, I'm sure. So, but thank you. I'm excited.
And we'll go to 6C and the Strategic Review Committee, which is Laura sitting right next to me, and I think she has an update. No
We
update?
have no
Oh, we had
update
it
at
last
this
time. Right. And then the next is our TRS Subcommittee, which is Gordon sitting over here, and I don't know. Add? That'll be coming up when we start our whole process for our grants for the next year. So we'll move on to E, which is our director's report, and he is not here, but Melody is going to do an update for us.
Hi, everyone. Good to see you all. I'm oddly nervous. I think it's because you're all in a line. So thank you, Penny and Susie, for hosting. It's a beautiful space. Really appreciate it. And really appreciate your partnership too. So I have a couple of items since Jody is out at the US Asian Conference in Chicago, and that happens annually. That is the membership organization for area agencies on aging across the country. So
It's to be called W4A or
4A.
4A?
N4A, it was the National Association of AAAs, yes. So they rebranded a couple of years ago, hoping he'll come back with some really good information from the different sessions that he's attending. He's also on a panel, so he'll be speaking there as well, and hopefully he'll have some great things to share when he comes back. So I have a couple of items. Yesterday we had our quarterly provider meeting. That's a meeting we have with all of our contracted providers, and I was actually able to share some good news. Feels like I haven't been able to do that in a little while, so was thrilled to do that. And the good news was that we were preparing them for an anticipated 25% cut in our funding. Great news is that we received our contract from the state. We didn't receive as large of a cut. So incredible news there. There was about 200,000 that was cut, but the AAA is absorbing that so that we're able to fully fund our partners. So
Fantastic.
So that was just really great news to be able to share. So we also talked about the process for that. So they have that money available to them now. We did that through a contract amendment, so we didn't have to go through the technical review subcommittee. So that has already been processed and was just really great to share that with them. The other good news was that, and I believe I shared with you all at the last meeting, we had our state Unit on Aging annual evaluation, and there were no compliance findings. I don't remember if we shared that last time. But never in my career have I seen that before. And that really demonstrates the incredible work that our providers have done. And all of the contract and policy and procedure requirements, they're hefty. We ask them to jump through a lot of hoops. And so they look at a number of areas, always nutrition and transportation. So we're always meeting with Penny every year. She gets to go through it. And then there are programs that are rotated as well. So we're meeting with at least 15 providers every single year, in addition to what we have to do, which is annually evaluate them as well. So they're constantly going through audits. Thank you, providers. So to be able to share with them, thank you. That was also really great to be able to share that news with them. So talking about the funding, we are going to release our RFP early this year. We have traditionally released it in December or January, and that always happens right around when we're surveying, when we're doing our evaluations. It's a lot to ask all at once. So the goal is to release it earlier. We're looking at September. This gives providers an opportunity to work on it, not over the holidays. That's the goal. So they'll have about 2.5 months to work on that. Part of that will be a required RFP conference. So it's a request for proposal conference. They'll have about 2 weeks to look at the request for proposal, then come to the conference with questions. There's a deadline for final questions, and then 2 weeks following that for the deadline itself. So that gives us a chance to move through committee faster. They'll be able to find out what their approved funds are faster, so that if they're working on other grants, they'll have a better idea of what their funds are. So we're hoping that this will be received well by them. We announced that yesterday, just to give them that time, so it's not falling at the same time as some other projects.
And that'll be a Zoom
Yes, we'll
meeting
have
as
it in
well.
person
So
and Zoom. Yes.
maybe the members of the TRS
Yes.
committee could be.
W, you read my mind.
We want to attend.
Please do. I encourage you to, just to see what kind of questions they're asked, especially if you are interested in being on the technical review subcommittee. It's a great opportunity to see what kind of questions are asked. And you'll also have access to the request for proposal as well. So you'll see the narrative questions that are on there, as well as the yes or no questions and all the documents that they need to submit. So please do, yes. We'll be talking to them too about some contract changes that we're going to be making. We received a recommendation from the state to implement active managerial controls, so that even if there is something that's not in our policy and procedure manual, we can still put items into the contract. There are some in there already, but this is really to mitigate risk to protect our providers and also PBACG. So those are things around accounting, data integrity, making sure that providers have strong processes in place. If there are any staff turnover, if anything changes within systems, we really want to prepare our providers for that and give them plenty of notice for any contract changes that are going to come up starting July 1st in 2026. We'll also be introducing new RFP scoring. So last year was the first year that those of you who are on the TRS, this may sound familiar. Last year was the first year we introduced scoring for different elements for the proposals. We're really beefing that up. You're going to see some new categories in there that also include evaluations, data integrity, communication. So there's going to be things that we're moving forward with the less subjective scoring, where we want to look at things like spend down, the program effectiveness, how well they're doing on evaluations, keeping to contract items, and really trying to take into consideration and reward those providers that are doing really well in those areas. We want to find a way to do that, and just to say thank you for this great partnership, and we recognize the hard work that you're doing administratively. Any questions about that?
So Melody,
Yes.
so when will the RFP be due? So releasing sometime September, and when is it actually going to be?
So
Have the actual date?
it'll be a beginning of December. Yeah.
And I'm wondering if we know, I can't remember. On our TRS subcommittee, we're always actively looking for other people to participate.
Yes.
And maybe with some of these changes, once we know who that is, we could have some kind of just maybe a Zoom meeting to update us and
Absolutely.
discuss some of those kinds.
Yes, absolutely. And TRS, you'll receive all of those proposals well ahead of time. We don't want to get together and have you read them while we sit around together, as much as we love each other's company, so that you can see it, you can grade, you can come with questions, concerns, anything like that. And also being able to see the spend down as well, so that you can look at that and see over time what the spending has looked like as a proportion of the funding as well. Yeah. Any other questions about that? Okay, so leading into my last item then, around the TRS, our federal partners, the Administration for Community Living, they're releasing new guidelines on conflicts of interest. So we just learned this at our last State Unit on Aging meeting last week. And so this may affect who can be involved in the TRS, since TRS does influence those funding decisions that then go to the full RAC and then finally to the board for our PPACG. So Jody's going to learn more about that. We will share those updates as we learn them. Right now, we don't have a lot of information. The point is that we want to make sure anybody who is on the TRS is not serving as a board member or in any way involved with somebody that we could potentially be funding. So we want to have all of that information for you before we make a decision about who is on the TRS, but making sure that that's all above board and that we're in line with the Administration for Community Living. That's it for me. Thank you. Any questions? Sure. So Penny asked a question about chargebacks. So the state we have a great system now. It's called SUDS. It's a state unit data system that some of you may have heard of. It was implemented about 2.5 years ago now. So with the robust system, whatever we put in, we're able to actually pull out with reports, things that are very detailed in terms of demographics and the kinds of client information that we can see. So with that, they're able to see then who is eligible for funding. The great thing about AAA funding is that we don't have a lot of requirements for who is eligible. So we're not means tested. It's not like benefits programs at the county where there's much more documentation that's required, but there are things that are missing for clients. And so with some of those, it's not just that you're 60 plus. It means you have to have certain other criteria for meals or chore. Those are 2 examples. So the state is going back and looking at eligible clients and seeing, did we pay providers when a client perhaps was not listed as eligible? They may be, but we don't have that documented. And all of us familiar with government, if it's not documented, it's like it didn't happen. So they're going back and taking a look at that. And in some cases, asking providers then to, they're recouping that payment, or what we're trying to do then is if we find clients that are ineligible, we're asking for that money back, but then putting it right back into the pot for the following month. So then that way our providers are not being negatively affected by it.
Some of those requirements were loosened, I think, during COVID. Right?
Yes.
And are they now coming back? And
they are now back.
Questions about that?
So all of those requirements under the emergency declaration, those have been removed. Yeah. So we're back to the original requirements and the original funding parts, which you'll learn about as well during the TRS and during the funding period.
If I remember correctly, those kind of affected home delivered meals and things like that. I mean, we were allowed to do more than maybe.
Yes, so with nutrition, they took away the requirements for the homebound definition. So a lot of the older adults that were really nervous about being in heavily populated areas, we were able to help them with meals So now that's been removed. They're redefining some things around grab and go. And then they put back into place the requirements around the different funding parts, and those are set at the federal level. So that's actually written into the act. It's part of the law. It's a good question.
Somebody had a question about printing that maybe.
Yes, so we'll take a look at that. So we do allow for providers to, and we welcome new providers to apply as well, to put that into their proposals if they have any printing needs. And we do fund some providers for that currently.
Super.
Yes, absolutely. Absolutely.
And even though the Platte County Canyon Alliance is not a direct provider, because I don't think you receive
Not
any
currently.
directly, but maybe through Penny, that could be something that could be looked at.
Yes.
And the last thing I wanted to ask you, because I know that Jody mentioned to me that maybe you could explain a little bit more about the 4-year plan, since.
Yes, so the 4-year plan, and Melissa can jump in too, because she spearheaded the last one, and really did an incredible amount of work with it with our community conversation. So the 4-year plan is essentially our strategic plan, and it's required as a part of our contract with the state.
Everybody, all area agencies.
Yes, so there are 16 AAAs across the state of Colorado, and this is actually a requirement for AAAs nationally. So they take the 16 4-year plans from all of the AAAs that feeds into a state plan that then they submit to at the federal level. So the 4-year plan typically, and in my experience, has been, wow, we did so much work on this plan and now it gets to sit on the shelf and look pretty. And so the great thing is that Melissa has worked with our strategic review subcommittee to really make this an active, intentional plan, that it actually does inform our services, our programs, our funding, our targeted populations that we're required to reach out to. So there are community conversations that happen as part of that, where people from the 3 counties get to come together and actually inform that plan to say, no, these are what the needs are, instead of us in our offices speaking about those potentially. We definitely want that input. So I think we were required to have 5 or 6 or something like that. Melissa hosted, was it 33? It was well above the number. We're also with the strategic review subcommittee doing an incredible job with tracking. So thank you, Melissa, for that. The state actually acknowledged that. They said that out of the 16 AAAs, we're doing the best job with that, actually being able to show the progress that we're making towards meeting those goals. And sometimes there are things that, there's only so much we can do, like with broadband, but the fact that, we're keeping things top of mind and doing advocacy where we can. So the 4-year plan, our next round for development is coming up again. Can't believe it's already been almost 4 years. So the RAC will certainly be involved in that. And if you haven't taken a look at it, it is online and we do have printed copies.
Starting in June of 2026. And I guess what I would like to add is that now that we have a full contingent of members from all 3 counties, we would love to see people on the committee, on the RAC, attending those meetings. I have done that in the past, and it's really interesting to hear directly from community folks on what their needs are.
Yeah, and some of those too are held at different meal sites, so it's incredible to see. So you can meet and see the locations for contracted providers that perhaps you haven't been able to visit before. So it's always a great opportunity to learn more about what's going on. Great question.
Any other questions?
Hi, Kathy.
Melanie?
Yes.
I think we're having trouble hearing you.
All right, let me turn it up. Hey, I had a question about, it's Kathy Lowry. I had a question about the RFP scoring. Are we going to be provided in that communication the different elements that are going to be scored and
Yes.
sort of what their weights are?
Yes.
Okay, thank you.
Yes, you certainly will. Yeah, great question. Thank you.
Other questions?
Madam Chair, if I can interject and maybe throw a softball to Melody, if we want to talk about staffing, local staffing with Katie and Chris.
Yeah, thank you. I appreciate that. Yeah, no, thank you for that reminder. So some of you may be aware that we took a hard look at our case management program and how we're serving the community with that. And so excited to, you all have, I believe, met Danica Hamilton, who is our new direct services supervisor after Melanie Hendrickson retired. And so we've been able to bring on new case management staff, and that includes Chris Lurie, who's here in attendance, and Katie Ostine, she's, I believe, online. And then we have another new person starting the first week of August. So we're going to have a full team and lots of learning happening and lots of training, but we're really excited to share about what that looks like as it comes along. Thank you, Jared. I appreciate that.
Thank you, Melody. Any other questions before she goes?
Happy to share good news. Makes me happy. Thank you so much.
This is the first month that we actually have a 6F. And that is going to be a legislative update, what's been happening, and Jared is going to talk a little bit about that.
I don't know if it's just going to be me, but Melissa, Melody, feel free to jump in as well. There was this discussion during executive committee earlier this month about adding this onto the agenda. And so I'll just kind of give a real life overview. Jody and I look very similar, so I'll do my best to channel my Jody. So a couple of things I wanted to point in mind, or keep in mind at the federal level, we're keeping an eye on S2120. That is the reauthorization for the Older Americans Act. I'm about a third of the way through it in reading it, but in looking at it, at least a third that I've looked at has not been concerning, and I think it would be something that we would be encouraged to support. Right now, it's listed at the PPACG board level as a bill that we are monitoring. The reason for that was at the time that the board cycle was going through, we had just got introduced a bill. We didn't have the bill title yet, but we were pretty confident that the bill is what it is now. But rather than kind of jump in and take a position before we had read it, like, let's keep it on monitor. It's not going to move that quickly. We have the time to review it and make sure we have any changes. We would expect the board to probably take a position on this bill in their August round of meetings.
No new titles or titles removed?
Not that I've seen so far. I need to kind of still compare it to what the last year's bill that made it through the Senate was, and see if it's basically the same as what was introduced last year, or if there's any changes. Again, through the third that I have looked at, I would say it was an overall, my impression so far was that it was increasing flexibility, while still maintaining accountability, if that makes sense.
Yeah, that's great.
And so it would, I hope, make it a little bit easier for us and providers to be able to do the work that we want to do, while still making sure that the money is being spent appropriately. If that's a simple way of explaining it, from what I've read so far, still got 2/3 left to go of the 90-page bill.
We appreciate your and Jody's involvement in making sure that isn't, nothing major is changing in the bill, because that really makes sure of what we're going to be doing as an area agency and as a RAC.
So, and then, so this document is just the overall PPACG bill tracker. And so I'll scroll up to the other one that, while it isn't direct to aging, it is going to, I think, be a positive one to keep an eye out. And these are companion bills. So the same bills are introduced in both the House and the Senate. The idea being that if they go through each chamber with no changes, then you save a step and have to go to the other chamber. This is HR 1733 and S784. This is the Rural Veterans Transportation and Care Act. One of our congressional delegation members, Representative Pedersen, is actually one of the original co-sponsors in the House on this bill. And what this would essentially do, it'll continue a VA grant program for transportation in rural areas for veterans. It will increase in flexibility. Most notably, it would allow county veteran service offices to be an eligible recipient of these grant funds. And so this is one that I think, especially with us being in Fair Play, this is one that I think would definitely help the Park County, the Taylor County outside of the Metropolitan Planning Organization. It has already had a hearing on the Senate side. It's still waiting a hearing on the House side within the Subcommittee on Health within the VA committee. So those are the two federal bills I kind of wanted to put on the RAC's radar. kind of coming back down to the state. Oh, let me stay at the federal side. So right now, House Appropriations is going through the fiscal year 2026 budget process. This is for the budget year that will start on October 1 of this year. They're going through the process right now. The Health and Human Services bill that we'd be looking at has not been scheduled. We have not received any markup. The president's budget proposal, I believe, kept it at flat funding. And so we'll see what the Congress actually does. We've already seen on some other bills that PPACG is tracking that specifically it's called a state revolving fund, but it helps with wastewater projects. The president's budget had it going from 1.6 billion to 155 million. The House appropriations actually proposed keeping that at 1.2 billion. So while it was still a cut, it was significantly more than what the executive branch had proposed. So all that to say that whatever the president proposes is just a proposal. It is still up to Congress to actually do the work. With the House now being in recess today, we are not expecting anything further on House appropriations until Labor Day. And then the Senate is still in session through the end of next week before they take their August recess. So that's the federal activity. I'm going to go ahead and jump down to state because there is some overlap between federal and state right now. So I'll say from the federal side, we had HR 1, which is the One Big Beautiful Bill Act. There was no direct impact to PPAAA. However, we do anticipate there will be several indirect impacts. With some of the cuts in other services, while we, for example, with Medicaid, the AAA does not receive Medicaid funding. And so the cuts over the next 10 years that are being enacted, while that won't directly impact our funding, we do expect that we're going to see increased calls for services or for help and just navigating, their options and just fielding those calls. Now, where what could impact funding is at the state level, because the state will have to account for those monies somehow. And so do we see a change in state appropriations because of that? Way too early to see. I will say the state budget forecast last month was released, and then there's two forecasts that have come out, one from the executive, one from the legislative, and both downgraded the upcoming fiscal year 26 state budget process. So the state budget year that would start next July. This forecast came out before the passage of HR 1, so it doesn't include any federal updates. But as part of that, the state was looking at a budget shortfall of about $600 million for the next fiscal year. Where that money comes from is up to the legislature. Obviously, we have already engaged with our state lobbyist partners, Ed Bowditch and Jennifer Castle. They have already met with members of the Joint Budget Committee. And specifically the homestead exemption, while it is an annual decision that the legislature has to make. In the discussion with one JBC member, he indicated that that would be among the very last things that they would look at cutting. There is a strong desire to preserve that and kind of make that as a last effort. Like I said, that $600 million shortfall for next year did not include any federal changes. And so what that looks like, as the state has to look at what Medicaid looks like. I will say the Medicaid provisions for the most part do not take effect until the end of 2026. So the state does not have to make those decisions yet.
Can you give an idea? I have no idea what 600 million is in terms of the whole state budget.
I might tap into our two council members because they might have a better thing. I want to say the state budget is 50 billion-ish.
10%?
Ish, I think is 46 billion. Okay.
So more than 10%. So more than 10%.
Yeah. So you'd be looking at probably closer to 1% because 10% would be about
Excuse me, 1%.
4 billion. And so, like I said, it's up to the state legislature. It's their decisions on how to do that. There are strong rumors of a special session being called, and if it is, it would be late August. I would say part of that discussion is we still need a special session because the Medicaid provisions don't really take effect until the next state fiscal year. there are some other provisions, SNAP, that the state might have to make some decisions on earlier. There is the Healthy Meals for All program, which is a school meals program that might, there are other reasons to possibly call a special session in Medicaid. There's also some AI provisions that the state could potentially put into a special session. But like I said, there's a lot of potentially coulds. There was a lot of discussion during the passage of HR 1 around the 4th of July week. And the JBC chair, Senator Bridges, even said that there will be a special session. I kept wondering why. Yeah, and I think a lot of us are like, what's, at least for me, and this is me being, speaking for me, not speaking for the agency, I don't see the need for a special session. However, there might be other provisions that I'm not looking at that may require that special session.
Yes, if I may, Susie Walton, Human Services Director here in Park. I've been attending a variety of meetings, and I have 2 more next week down at the legislature. They don't have staff right now, but they are still meeting. And there probably will be a special session because there are parts of HR 1 that were enacted upon enactment. Right, so Human Services has to figure out a whole bunch of stuff, largely related to food assistance, refugee services, variety of things. The Medicaid picture, I think, yes, while the law doesn't go into effect exactly until at least the end of 2026, rules will still have to be promulgated. We have an opportunity now to impact and kind of head off some of the provisions of that legislation that are, could really, really hurt our seniors. Largely, the Medicaid cuts around closing nursing homes, skilled nursing care, that kind of thing will really, really impact seniors and rural hospitals, things like that. So there's a whole lot of activity. I've been trying to stay abreast of a lot of that, going, like I said, to a couple more meetings next week. I love that we've added a legislative update, and I'd be happy to help serve on that and kind of keep information flowing, certainly from the human services angle, because it all will affect our seniors. It absolutely will.
Yeah, I think it's a real helpful piece, not only because of us on the committee, but that even attend our meetings on Zoom, just educating them more about what's going on. So it's been really helpful.
Definitely, and that was literally the end. So I was about to ask for questions and comments. So Susie jumped right in. And I say we are very fortunate with the makeup of the Regional Advisory Committee right now, because we have elected officials, former elected officials, people who have dealt with this probably more than anyone would like to care to admit. Painfully, yeah. No, it's I joke I had hair when I started doing this. It wasn't much, but it took care of the rest. So yeah, no, I think any and all, just because, for me, I'm very focused on how is it going to impact the AAA. So while we wait, there are some other things that are, like I said, there's a lot of things that will impact us indirectly, and I think in some pretty significant ways. At the end of the day, I think we will still have jobs, we'll still have programs, we'll be able to service what those wait lists look like, what kind of calls we get, what kind of information are we going to be asked for. I think those are the things that are really going to be changing for us as we navigate this.
Jody usually kind of incorporates a lot of that into his director's report, but I think it is nice. Maybe specific date would be.
I was just going to say, so during the non-state session, so now, The Pikes Peak Area Council of Governments Board of Directors Legislative Committee meets monthly, typically the first Monday of each month. I say typically because Labor Day will force it to the second week. This is the first year that PPACG has really taken that federal role. And realizing that while a lot of times we see the state government, because we're closer to that, a lot of our funding is coming from federal sources. And so we decided that during the administration change, during the change of Congress, now is a good time to really dive into that. We're diving into it. But I mentioned the legislative committee because those are public meetings. Anyone is more than welcome to attend and just listen what that discussion is. I'll just kind of keep in mind we are looking at transportation reauthorization as well. So we've got two big reauthorization bills which account for the PPACG. Plus, we're looking at some STC, the Office of Local Defense and Community from the Department of Defense. Some funding sources, like I mentioned, state revolving fund, water.
Zoom meeting.
So those are, those are
Could my
team.
name is interested be added to that so that I get it email
I'm
about it?
happy to. We also send out weekly federal updates. That it's starting to get a pretty good distribution list. So I'm happy to add anyone who wants to. Just feel free to contact me.
And while I have you here, the spelling of my last name on that list is incorrect. So I'll tell you now, Stankevich is the second.
Thank you. I apologize for that.
No, not a problem. I'm used to it.
Hey, Melissa, can you turn your mic on?
It was on, sorry. I am here to kind of do a little reminder about the Pikes Peak Commission on Aging as kind of the partner organization to the Regional Advisory Council. So the Pikes Peak Commission on Aging was created as an advocacy commission. And so they have been working on what that can look like within the auspices of the Pikes Peak Area Council of Governments, knowing that the Council of Governments board has its own legislative committee. And so we are getting much closer to figuring out kind of how that partnership and relationship works. We've actually had Regional Advisory Council members attend the Commission on Aging meetings regularly. I'm looking at Laura. I think she's a big one. But we've had other ones who have attended it as well, which is really good. And in light of kind of what's happened with the passage of this bill, we have Steve Schlaker on the Pikes Peak Commission on Aging, who is the current county clerk and recorder for El Paso County. But prior to that, he was the county assessor, and he was very involved with the senior homestead exemption program. And he recommended to the Commission on Aging to immediately put together a draft paper to support at the state level keeping the Senior Homestead Exemption Act, because that is something that often gets cut whenever there are funding shortages. So in order to make that happen and make it a formal advocacy action item, the Commission on Aging has to put together the paper for that, and then ideally send it through the legislative committee with the PPACG folks, and then on to the PPACG board. And so we are in the process of doing that right now and seeing how that will work. And so again, he is very well versed on everything with the Senior Homestead Exemption Act. He's been doing it for years. So it's been really helpful to have him involved in such a thing and to realize how important it is to put that out immediately. And so for people who are on the rack and for our providers who are on the call as well, I would say if you are seeing anything that you think would be beneficial, Susie, you just spoke to quite a few things that you're dealing with, within your office, which we know is going to trickle down to area agencies on aging and different services in the community for sure. Please, share that with the RAC, share that with the Commission on Aging as well, so that they can be the voice that's going to formally put together, a position paper and send that up through the PPACG board. And again, individuals can definitely do advocacy on your own, but we would really like to see the Commission on Aging be able to have a really formal advocacy stance and be able to stand up for not just El Paso County, but Park and Teller as well. And so just please keep that in mind as we move forward with that. And we'll keep an update going on how that senior homestead exemption, kind of paper moves through the process and where that lands in the end.
And that is the bill where they were trying to get it to extend if a person moved from one location to another location to keep that exemption. And I don't
No, there's actually they can cut it out altogether and stop it altogether because it's, and I can't speak really too accurately about it, but it is something that is at the jurisdiction, at the give and take of the legislature at the state. And so they have cut it in the past. So what they were trying to do last year, of course, was just to try to expand it. And so that wasn't allowed, but there is still, so the base that it's at is always at risk anytime there's a budget deficit where they can take that away. And Steve, being the county assessor, he actually saw in years when it was dropped where people lost their homes because they were not planning. It's a pretty significant chunk. It's about a $600, benefit that older adults who are usually lower income benefit from this. And so when they are suddenly hit with having to come up with an extra $600, on top of everything else they might have to do, and then sometimes they just don't even open their mail and find out that they have to pay it. And so then, the next thing they know is when they have a lien on their property and they're going to auction. So he knows it, he's walked it. And so it's nice that we have actually a really specific action item for the Commission on Aging. And I just open that up for if anybody else has something that comes up that could be an action item, bring it to our attention so that there can be some really strong advocacy there.
else. Okay, I think we'll just move on to the last, which is my report, and I won't make it long. I guess I just want to thank Penny for hosting this meeting. It was really great. I love coming to these meetings that are out of our area. I'm even new to the Colorado Springs area, so it's really nice to learn a little bit more about our whole area that we cover. And I guess, I or Melissa like some feedback. I think the meeting was pretty technical today about all the legislative stuff and things going on. And I personally would like some feedback if people felt that was helpful or just too much, especially those folks online. And that's pretty much all I have to add for the chair report. So we'll move on. I don't think we have any discussion items, but we'll just move on.
Not really so much a discussion item. However, I do think it's a little bit of an announcement maybe. So I have two things I'd like to share. First, I'd like to have Don remind us what he's doing this weekend.
Thank you. I am president of the Exchange Club of Falcon nonprofit Falcon. And about 6 months ago, we had a guest speaker, Pikes Palliative and Hospice Center, explaining about how the senior organization worked. I felt that out in Falcon in the Eastern Plains area, that we have a lot of seniors out there that probably don't know what resources are available to them from El Paso County because they're out in Falcon, Callahan, Peyton, Black Forest. So I went ahead and it's the first time we're doing it. It's what we're calling the Eastern Plains Senior Resource Expo, where I've invited about 20 resource agencies, senior resource agencies in El Paso County to come out to a school in Falcon It's this Saturday from 9 to 2. And I have several agencies coming out, and I have a list here of Home Care for Heroes, Pikes Peak Hospice, Mount Carmel Service Center, Pikes Peak Area Agency on Aging, Rocky Mountain PACE, Alzheimer's Association. So I have several other organizations coming out where it's a free event for our seniors in the Eastern Plains to come out and see what's available to them that they don't know about. You know, as far as transportation services, I have chefs for seniors coming out. So yeah, that going on. It's a free event for anyone living, you know, and even in Colorado Springs area if they want to come out. It's at the school. It's this Saturday.
Thank you. That's it. Well, actually, we'll be out there. We'll have a booth. So if anybody from the RAC wants to come out and visit, let me know. I'll give you the address and come visit.
Great. And that was it. I thought that.
All right, I'll share the second one. So the Pikes Peak Area Agency on Aging does monthly presentations with the Pikes Peak Library District. And we had a presentation this past, I guess it was yesterday, on traveling solo. My traveling solo person was not able to come because her father has been diagnosed with cancer and she had to leave town immediately. He's already on hospice and it was pretty tragic. And I was like, who am I going to get to talk about traveling solo? And I realized that Dawn is often emailing me saying, Melissa, I'm traveling again. I can't make it to the RAC meeting. And also somebody by the name of B, just got back from a bucket list trip. And so I asked both RAC members very last minute if they could present, and they both stepped in and presented. And it was a great presentation. It was up in the Palmer Lake Library. And it was just a really good conversation about great traveling hints. And even though Don travels a lot with his significant other, B does do some solo traveling, and Don had a lot of really great ideas and tips, and B was full of great information too. So a thank you to our RAC members who did a little extra this month, totally at the very last minute. So I really appreciated it. Thank you.
And I guess I'll add that the AARP website has a lot of information on solo travel. And they'll send you lots of information. All right, we'll do our last thing here, which is meeting schedule. Our next meeting is in August, and it is in the Monument Town Hall. And there we'll be hosting the meeting. And just to let you know, we have a RAC Executive Committee meeting. That's the first Wednesday of each month, and the chairs of all of the subcommittees meet and kind of go over what we're going to discuss at our next meeting. And then the last thing on that list is the PPACG, and I think that's the second Tuesday of the month?
Second Wednesday.
Second Wednesday of the month. Thank you. And that's all I have. So I'll make a motion to adjourn. All for coming.